Welcome viewers to the Right Start Early Childhood Development Talk Show. My name is Jessica Brown and I'll be moderating today's discussion. Thank you very much for joining us. These series of discussions are part of the National Right Start campaign. The campaign is jointly hosted by the Ministry of Gender Equality, Poverty Eradication and Social Welfare, the Ministry of Education, Arts and Culture, and the Ministry of Health and Social Services. And this national campaign seeks to raise awareness and reinforce the importance of the early years of a child's life. Under the slogan, "Make a child's first steps the right steps," the campaign seeks to promote behavior change towards the optimal development of children, improve integrated ECD policy implementation and service delivery, increase national funding for ECD, and improve the frequency and quality of conversations about how critical these early years are, as informed by research in neuroscience. This campaign is supported by the European Union, Interteam Switzerland, and UNICEF. Health and nutrition are vital components of integrated ECD. Access to quality health and nutrition for both the mother and child are key to building strong and healthy young people. A strong foundation for healthy development during the early years of life is an important prerequisite for lifelong good health and well-being, thriving communities, economic productivity, and a harmonious civil society. Stated simply, a promising future belongs to individuals and nations that invest wisely in the health and nutrition of their youngest. In today's discussion, we are going to talk about health and nutrition interventions needed to provide a child with the best start in life. We will also discuss how to keep children safe and healthy during the COVID-19 pandemic. Let's have a quick look at this informative video, and when we come back, we'll say hello to our guests.
Continuing to breastfeed is best for both mother and baby. Breastfeeding helps to ensure that your baby will grow up healthy and strong. Breastfeed for as long as possible, ideally 2 years and beyond. Working mothers, express breast milk and feed the baby by cup. To find out more about breastfeeding your baby, speak to your nearest health worker or visit www.rightstart.com.na.
Joining me today for this very important discussion about ECD and the Right Start campaign as it relates to health and nutrition is Ms. Nicole Angermund, the Program Officer for Maternal, Infant and Young Child Nutrition. Welcome. And also present is Ms. Rosemary de Walt, the Senior Program Officer for Child Health at the Ministry of Health. Thank you very much for joining us and welcome.
Thank you.
So Nicole, we'll start with you. What would you say are some of the risks that the COVID-19 pandemic poses on good child nutrition?
I would like to start with breastfeeding. As we know that breastfeeding, especially breast milk, is the best food for babies, especially from 0 to up to 6 months of age. And we call that exclusive breastfeeding. And we as Namibia, the same as the rest of the world, accepted the global recommendation that the child should be breastfed exclusively for the first 6 months and then up to the age of 2 years. So there has been rumors going around about transmission of COVID-19 through breastfeeding, but some studies are underway, and currently there's no evidence that show that COVID-19 is present in breast milk.
Okay.
However, when a mother do breastfeed her baby, she should still apply all the protective measures. She should wear a mask, she should wash her hands, she should clean the surfaces around her, but breast milk, the milk from the breast itself, is very safe for the baby.
Okay.
And that is the best we can recommend for children up to the age of 2 years.
Great. And if I can ask just to clarify, when you say exclusive breastfeeding, what specifically do you mean? What should parents avoid doing?
Okay, we mean giving the baby breast milk only, no water, no medicines or syrups, unless prescribed by a medical worker.
Okay. And that would also include no teas, no juices, only breast milk for the first 6 months?
For the first 6 months of life.
Thank you.
And then the mother can continue breastfeeding from the age of 6 months with the addition of complementary foods, which we will discuss later.
Okay, and so just to clarify, the position of the Ministry of Health at the moment is that parents should continue to breastfeed their young children and not be put off by the COVID-19 pandemic, not to believe that the breastfeeding can cause any harm that we know so far, but just to still be cautious, to still be very clean, and to still focus on mitigation measures.
Yes, it's more the practice of breastfeeding because she's in contact with the baby.
Okay.
That is what we should be careful about.
Great.
But transmission through breast milk, there's no evidence that can say that COVID-19 can be transmitted.
Thank you very much. And so, Rosemary, if I can move on to you. We know that even before a baby is born, the health and nutrition of the mother is really vital. And specifically, when mothers are pregnant, what should they be doing to ensure that they're giving their children the best start in life before they've even been born?
Okay. We know it is very important that women need to know that the baby's development starts very early, especially after conception. So the first 3 months of the pregnancy is very important for the growth of the baby. And when a woman identifies that she is pregnant, she needs to go to the nearest health facility so that they can do the normal processes, follow up this woman during a time of pregnancy. Also, the support of the family is very important for this mother. You know, a pregnant woman needs to eat 3 meals a day.
Yes.
And in the same time, she also needs 2 extra meals, especially for the growth of the baby. So we call it 2 snacks. So the Ministry of Health, we are currently working on the nutrition procedures, and this will be available for the mothers, for the pregnant women soon, and so that they can know what processes to follow. So once again, the family is important, and the support of those ones staying near to her so that they can help her to follow these recommendations.
Thank you very much. And if I can just follow up, when a mother does attend a clinic and she goes for her first antenatal care, what kind of services and information will she be getting from those sessions?
Yeah, there are a lot of information. As I already said, that it's important for her to come to the facility as soon as she identifies that she's pregnant, especially within the first 3 months. So what the health service provide is that they will draw blood from the mother, different types of blood that will be drawn, tests like HIV, RPR, we call it for venereal diseases, and those type of things. And then also in the same way, they will also provide counseling to this pregnant woman, especially on feeding, the correct feeding practices, also on physical activity, so that this mother during pregnancy does not gain excessive weight. And then also they will provide iron supplementation that she will take daily, so because to prevent maternal anemia. And also they will provide additional testing like HIV, as I mentioned, for the prevention of mother-to-child transmission, so that this woman can be put early on treatment if she is identified that she is HIV positive. Just to add also, during the first 6 months, they need to do a sonar testing, ultrasound, so that they can identify the gestational age, what we call is the day that the baby will be delivered, or how many weeks this woman is pregnant. So this is what the health services provide.
To my understanding, once the mother has gone for her initial visit to the clinic, if there's any follow-up needed or she needs any additional medical support, then she will be referred onwards to different services.
Definitely they give her follow-up dates, because she needs to come regular for the follow-up visit, so that they can also check the growth of the baby, or if there's any maternal complications, that they can take care of that.
Would you like to add anything, Nicole?
Yes, it's important for the mother to come back for a follow-up session.
Yes.
Because like Rosie has stated, her growth measurements will be taken as the mother, but then we also see how the baby is growing. And then also it's an opportunity for the health workers to counsel mothers, and then they can also ask them questions to get more information, if I'm doing the right thing, if I'm eating the right food, you know, so that I can have a better outcome when I do deliver.
So I think it's very clear that mothers that attend ANC from early on, as soon as you suspect you might be pregnant, they have a much better chance of having a healthy pregnancy, a healthy birth, and the child has a much better chance of surviving and thriving. We are talking about early childhood development, and we'll be right back. Welcome back, and now we will continue with asking some questions around ECD and the Right Start campaign. So Nicole, if we can go back to talking a bit about nutrition during pregnancy, what are some of the effects of a bad diet on the baby during pregnancy? And what would you recommend for a pregnant woman to do specifically?
Like Rosie said before, it's important for a pregnant woman to eat at least 3 meals a day, and then have 2 snacks, whether it's a fruit or something else during the day that is in addition to the 3 meals that she's taking. It will ensure that she and the baby get good nutrition, and we know that can prevent complications. It can reduce the risk of premature birth when a mother goes into delivery too early, or when the baby grows is too small where the child is born, or any other complications that may occur. And then we also know that there are bad things that one should not do during pregnancy.
Certainly.
Of course, avoid alcohol completely. Smoking, please don't smoke, because it leads to a smaller baby when you give birth. And then especially when it comes to the type of foods that you eat, you need to eat a variety of foods.
Yes.
What we call basically a 4-star diet, which includes your staples, your yellow vegetables, your green vegetables, some animal foods, which can be meat or dairy, but if it's too expensive, maybe beans, whatever is locally available.
Eggs?
And then also eggs,
Yeah.
yes, and then also some beans and legumes that they can eat. So this is what we would like them to have 3 times a day.
And I think also it's important to stress that if there's families where priorities have to be made around who's getting the most nutritious food, which we know is the reality in Namibia, that the mothers and the young children should the pregnant mothers and the young children should always be prioritized, because they're the ones that are helping to grow these little people and grow small brains.
I just want to add, also have a regular intake of water during the day.
So we know that in Namibia we have a diverse range of cultures that have different diets and different traditional foods. But would you say that this 4-star diet, as you refer to it, that this is a recommendation that every cultural group in Namibia, every language group, every, all of our different traditions, this is something that we should be aspiring towards?
Yes, we know that we have challenges, but there's also a way to overcome these challenges. And most of these groups that I've mentioned before, you will have a staple in your household.
Yes.
You will have at least a vegetable in your household. You will have, whether it's an egg or a piece of meat or beans in your household. So take as much as you can from the different food groups that's available. And this is what you should have during the day.
So we're really stressing this diversity across the different food groups. That's what we need to have all of the necessary vitamins and minerals and so on to.
Yeah, and in addition to that, we also provide pregnant women with iron and folate supplements when they are pregnant, and that is just to boost their hemoglobin levels to make sure that they have enough iron in the body and that the baby is also okay.
So Rosemary, now maybe if we can talk a bit about child health. We know that from the age of, from birth to the age of 5, children have to have a range of different immunizations. But we also know in Namibia sometimes there can be challenges for children to get all of them or to complete their course. So could you just tell us a bit more about why these immunizations are so important and where parents can go to access them?
The important thing that we need to know is that when we think of immunization, we think of an injection. But the first immunization a baby needs is from the mother. So it's very important for the baby, as soon as the baby is delivered, that the baby starts to be put on the breast. Breastfeeding is one of the first areas where the baby gets immunization from. So we know the first milk, the colostrum, is the one that helps the baby to develop antibodies.
Oh, wow.
And it's, we know that immunization is very key for the baby, and the Ministry of Health are providing these services for free. So from birth, they get the first dose in the hospital, and then as the mothers know, and according to the child health passport, it is explaining exactly the schedule that the baby must follow to be vaccinated against these diseases. So the first dose the baby gets in the hospital, that is what is provided to the baby. And then the second dose is after 6 weeks, and the third one that follows is after 10 weeks, is at the age of 10 weeks. So this baby gets immunization until the age of 5 years. And these ones are to protect the baby against any diseases, the common childhood illnesses that we know that is in the country.
Thank you. And then do the parents get the health passport when they have the baby at the hospital?
We have 2 health passports. We have the pink one for the girls and also the blue one for the baby, so that the mother can already differentiate. And also when they come to the facility, that these 2 types are for the different sexes or gender.
And then the health passport shows very clearly what immunization the child needs when.
Yes.
So it's
yes.
easy for the parents to keep track of what is due and when.
Yes, definitely.
And then the parents go back to the clinic or the hospital generally. But I understand that also there are some immunization campaigns to go to try and reach regions. Is that correct?
Yeah, that immunization campaigns that you talk about is supplementary immunization campaigns.
Okay.
Because sometimes you may find the children, there is a dropout, especially also to increase the coverage of the country. So then the ministry reach out, the regions goes to the specific areas, especially the low coverage areas where they vaccinate these children to make sure all children are on the same level and to prevent them from any outbreaks. In the past we have different types of outbreaks like measles outbreaks, and that is why we try to make sure that the immunization status of the baby is up to date.
Thank you very much. And if a baby should be born out of a clinic or a hospital, can community health workers or other health outreach workers provide families with the child passport and also the immunizations?
Yes, definitely. These mothers also need to bring the baby to the facility to register the birth of the baby, and at that time the baby is also vaccinated against this childhood illnesses.
So I think really important to stress from what Rosemary said today is that these immunizations are free, that the cost of them should not be a barrier to any Namibian family, and that the health passports that are provided also for free make it very easy for families to track what immunization your child needs, when, and which ones are due, and why as well. So Nicole, we've spoken a lot about breastfeeding, and I'd just like to ask you again, why is it so important that we really do encourage our mothers to breastfeed and to breastfeed exclusively for 6 months and up to 2 years?
Yes, exclusive breastfeeding is the best food, is the ideal food. I call it the golden food for a baby up to the age of 6 months, because it contains all the nutrients, all the water. So there's nothing really needed that should be given to the child in addition to the breast milk.
Okay.
It has benefits for both the mother and the baby, and also then for the community at large. Benefits for the baby includes a better health. The baby gets sick less.
You get the immunization through the,
Yes, the baby gets sick less often with ear infections or diarrhea, because there's nothing being added to the breast milk that can make it unsafe. Science have also proven that children who were exclusively breastfed and continue to breastfeed up until the age of 2 years are clever children. I want to call them clever because it's talking about an increase in intelligence. But if we as Namibia can do that, breastfeed our babies exclusively, I think for the rest of the population in future it will be a huge benefit. And then for the mother, of course, there are benefits as she's in better health. The longer she breastfeed, the better her chances are of not getting ovarian cancer, breast cancer.
Remarkable. Yeah.
If she breastfeeds exclusively, for example, give only breast milk, feeds up to 8 to 12 times a day and night, and she didn't get a menstruation, it's even a family planning method.
Yeah,
so she can use that as a way of not falling pregnant. And in some cultures, we know that they wouldn't like to take family planning until the child is older. So there are a few benefits. And then it's also for the economy. It's cost, I don't want to say it's free and it's not cheap. It's cost effective.
Yes.
Because she doesn't need to spend money on buying formula. And then the unsafe practices when you do make formula in a country like us, we do not always have safe water, so that may also be an influence.
Great. But we know, so it makes total sense. Good for mother, good for baby, good for the country, good for the economy. But I just wanted to ask, some parents, we know some mothers do struggle with breastfeeding. So if you are wanting to exclusively breastfeed and you want to be breastfeeding your child but you're struggling, is there somewhere that they can get some help?
Yes, what we've done throughout the country is all health workers are trained in how to counsel a mother.
Okay.
And the counseling should start immediately in the postnatal ward. When the mother delivers, the mother should be shown how to put the baby on the breast so that the baby can attach well, and that will make it easier for the mother when she gets home. And then general advice is also what to do if she doesn't have enough milk, what signs to look out for, and then every opportunity when she has to visit the facility, these issues can be addressed again and she can be counseled.
Great,
so our health workers are trained, and also the community health workers that are out in the field.
Thank you. So if you are trying to breastfeed and you're struggling, please do contact your local clinic, your local health worker. More information can also be found on our website, www.rightstart.com.na. And Rosemary, I think you wanted to add something.
Yeah, I just wanted to highlight that during pregnancy, the counseling already starts on breastfeeding, so that mothers are prepared psychologically to breastfeed their babies and to know the importance of breastfeeding, as Nicole already has highlighted.
Great.
So the whole process is followed from conception until delivery and afterwards.
And I think what's also very important just to stress is that as a nation, let's also try and be more supportive of breastfeeding mothers, giving mothers time in the office or in an office space to go and feed or to go and pump, making sure that we have policies that respect and encourage breastfeeding, and just normalizing it again. Like we said, it's cheap, it's healthy for mother and baby, it helps to build a strong base for our young people. So I think that's something that all of us should be championing. We've been talking about early childhood development, and we'll be right back. Welcome back. Our discussion today has been about early childhood development and the National Right Start campaign. So I'd just like to ask both of you some of your thoughts around, in Namibia, we still have quite an alarming stunting rate, and especially for an upper middle income country. So I'd just like to know a bit about why you think this is. What sort of practices and behaviors are we seeing that are contributing to child malnutrition, and what can be done differently to try and address this? And Nicole, I'll start with you.
Some of the challenges we're experiencing is that mothers are stopping breastfeeding too early. And they introduce other foods in addition to breast milk from the age of 3 months.
Okay.
And we know that that is not a good practice to follow. This is where malnutrition can set in, because the child is not getting all the nutrients from the breast milk. And in addition, it also depends on the type of food that the mother is giving. And culturally in Namibia, and we've experienced it even through studies we have done, that the consistency of the porridge, like the thickness of the porridge that mothers are giving to the babies or the caretakers are giving to the babies, are too thin. So it should actually be made in such a way with it, when you feed the child, that the porridge should stay on the spoon, it shouldn't run off the spoon.
Okay.
And then we can also enrich the porridge with peanut butter or kind of fat so that it is more nutritious.
Okay.
And then, of course, the emphasis is babies should get the same food that the mother eats, that everybody else in the household eats.
From the 6
From
months?
the age of 6
Okay.
months. So it just depends on how you prepare it, because
Okay.
a child cannot eat at 6 months, chew a piece of meat, but you just prepare it in such a way that it's easy for the child to eat.
So cutting into little small pieces, helping to kind of grind it up a bit.
Yes.
Okay. So Rosemary, and if I can ask you the same question.
Yes, we know, mothers assume that they must go to the shop to buy food for the babies. But it's best to feed the baby from the same family pot that they are cooking. What we recommend is that they don't add the salt or the spices before, and then they just take the food from there and feed the baby.
Okay.
So in that way, they don't have extra cost involved for this baby to feed them the right type of food during this period. And also the local available foods are very nutritious for the baby. So we recommend that mothers should consider that. What I also want to mention is that sometimes mothers, when they struggle with breastfeeding, they may go for bottle feeding, but the ministry does not recommend that at all. They can rather put the milk in a cup and
Okay.
cup feed this baby. Even from a day 1 old baby, they can start taking the milk from the cup.
And can I just ask why? Why is it that the cup is preferable to a bottle feeding?
There are so many disadvantages of bottle feeding,
Okay.
especially healthy-wise. When the baby, usually what mothers do when they give the baby the bottle, they let the baby lay down and the
Okay.
baby drink the bottle itself when they can grab the bottle. So this can cause also ear infection.
Okay.
The other thing is that sometimes the bottles are not clinically
Disinfected and- yeah.
clean. So the mothers don't take time to make sure. Even what we have seen is that in the teeth of the bottle, a lot of germs stay behind. It is
Okay.
not cleaned properly. So this is what. So bottles are not prepared hygienically. As Nicole mentioned, the breastfeeding is safe, it is at the right temperature. Sometimes the baby may even burn, or the feeding can be too cold and then can cause abdominal cramps.
Okay.
So there are a lot of disadvantages around the bottle feeding, and we would rather recommend that they give the baby just the breast.
And I believe also from some of the infant and young child feeding research done in Namibia, one of the things that was found is that sometimes children are being left to feed themselves, especially when they're sort of toddler age.
Yes.
And that it's really important for parents to be actively involved in feeding the child, ensuring that the food is going into the mouth and that the child is eating it. And that's a very simple, quick fix to ensure that a child is getting all the nutritious foods that are intended for them, so that it's not being wasted on the dish, on the child itself, and that they're actually eating the food intended for them.
Very important is also to give each child his own serving, because if a lot of siblings feed from the same plate, you don't know how much food this child received. So then the mother can observe. And what we recommend for the age 0 to 2 months is that at least a 3/4 of a cup feeding that the child must take with every feed.
So we're going to wrap up shortly. So I just wanted to ask you, do you have any final remarks? If you had to leave parents with just a few key points to remember, what would your final remarks be? Maybe starting with you, Nicole.
I just want to highlight the importance again of the child health passport. This is the blue one for the boys and then the pink one for the girls. In this document, and which the mother or the caregiver should always have with her when taking a child to a health facility or where the community health worker is visiting the household. In here, we will find the dates that Rosie talked about when to come back for immunization. We'll also find the same pictures on the food groups that are available. We will find the advice to how to feed a child from 0 to 6 months, which is breastfeeding, from 6 to 9 months, what to give, from 9 to 12 months, and then up to the age of 2 years. So the information is in here. Also, I want to emphasize that we have a golden period until the age of 2 years to make a difference in the child's life. So everything depends on what we feed the child, how we feed the child, when we feed the child, how do we take care of the child, like you were saying. And if we do most of the things right, exclusively breastfeed for 6 months, continue with breastfeeding up to the age of 2, giving the right quality of foods to the child older than 6 months. We have this chance to feed the child properly, to take care of the child properly, and especially with COVID-19, I want to emphasize we're taking the right precautions at home, always washing our hands, sanitizing our hands, make sure that the child is clean, make sure that you as the mother, whenever you prepare food or give breastfeeding, you yourself have cleaned your hands, you wear your mask, you clean the areas around you, because this is very important. Hygiene and nutrition goes hand in hand. So if we don't do the one, it affects the other one negatively. So I think that is what I want to leave with the audience.
Thank you very much. And Rosemary, your final remarks?
I think, Jessica, what Nicole said has summarized everything. What I would also like to emphasize is during this time that your baby grow up, the importance of play in stimulation is very key. So make it a very interesting a time of life journey that you go through the whole process, because we know that the development of our children is very important. Thank you.
Thank you very much. So I think from today's discussion, we've really summarized mothers, start visiting A and C services from as soon as you think you might be pregnant, and continue visiting those services and really benefit from all of the information and services that you get through that. Once the child is born, exclusively breastfeed for 6 months, continuing for up to 2 years. Then start from 6 months introducing a diverse diet, ensuring that hygiene protocols are met. And at the same time, give your child nurturing care, stimulate your child, and ensure that you're really engaged in the feeding and the monitoring of this child's growth. So Ms. Rosemary de Walt and Nicole Angermund, thank you so much for joining us. And having this opportunity to reflect on the importance of child health and nutrition in the early years. If you'd like to find out more about anything discussed here today, or learn more about how you can make a child's first steps the right steps, visit our website at www.rightstart.com.na. You can also find us on social media on all the handles displayed on the screen right now. Thank you so much for watching, and find us again for more discussions on the Right Start. Goodbye.